Hello, I am Dr. Gaurav Luthra. Welcome to my LifePage. Today we are going to talk about eye surgery. So before that, let me give you a brief introduction about myself. I was born and brought up in Dehradun, and I did my schooling in St. Joseph's Academy, Dehradun, and went on to do my medicine in Maulana Azad Medical College, New Delhi, followed by my post-graduation at the same college as well, and eventually came back to settle down in Dehradun in 1998 after finishing all my studies. I have been practicing eye surgery since 1995. Now, an eye surgeon is a specialist surgeon who does post-graduation in eye surgery after becoming a doctor, that is an MBBS. And eye surgeons can be of various kinds. So you can, once you become an eye surgeon, you can go on to become various kinds of specialized eye surgeons. I would think that biology is one of the most basic and important aspects of education for an eye surgeon. If you identify yourself as being good with biology, you would probably enjoy being an eye surgeon as well. The first one being empathy. So if you can empathize with your patient, you can really treat the patient well, and you will have more satisfied patients, and you will be a satisfied doctor as well. When you're an eye surgeon, you have the chance of making a difference to somebody's life. You can give them the gift of sight, and that probably gives you the biggest satisfaction that any other form of occupation would be able to give you. First amongst them being that it's very equipment intensive and investment intensive. So as I said before, technology is an integral part of being an eye surgeon. Now, technology always comes at a cost. So industry spends billions of dollars in research when they develop new equipment, and they all come at a very huge cost. So from being from an eye surgeon being just equipped with a few small instruments 20 years back to I wake up in the morning at about 6:30, and first thing for me is to go for a game of tennis, which is one of my passions. And I usually play tennis from about 7 to 8 a.m., come back home, do some of my my work, which would include answering emails and setting my priorities for the day, maybe transferring some kind of the day's plan to my staff in the hospital on email or on their messaging systems, and ending up with having my breakfast, getting ready, and reaching work by about 10 a.m. And once I'm into the hospital, the day takes off even before I walk into my chamber. Right from the time you reach your parking lot, you could be caught up by the staff or maybe some patient who's been waiting to catch you. And once you get into your the OPD, life just takes off, and you don't know how time flies. And before I know it, seeing my patients and handling responsibilities between being a doctor, an entrepreneur, and managing my hospital, I divide time between all these things. So it's a non-stop process for about 6 to 7 hours, where I am rushing through seeing patients and handling emergencies and doing a lot of other hospital-related work. And before you know it, you don't feel hungry at all through the day. I usually end up having my lunch only when I finish my OPD and my administrative responsibilities by maybe 4:30, 5 o'clock. I don't feel hungry. I don't even feel the urge to have a cup of tea in between, because work is so intensive and occupying and enjoyable as well. I never feel that work is a pressure for me. After that, get a short break for about half an hour to an hour, where I collect myself and get that brief period of rest, because after that comes surgery time for me, and I need to be totally relaxed. And so about an hour after I finish my OPDs and have my lunch, I'm all set to go for surgery. Now, surgery typically requires a couple of hours, maybe 2 to 3 hours of doing 7, 8 or 10 surgeries. They could be cataract surgeries, they could be LASIK surgeries, and sometimes a few other surgeries. So once an eye surgeon is in the operating room, I think that is that's the time when I'm most relaxed, although I'm totally at attention and I'm on my fullest best, yet it's also very relaxing. So end of the OT, while I may feel physically and mentally tired, I also feel very satisfied with what I've achieved. And these are exciting times in the operating room, where you are innovating and being able to help patients with newer and newer techniques of surgery. And usually I finish my day anytime between 8 p.m. to 9 p.m. when I head back home or for my other social obligations, and that's how my day ends. I hope I've been able to give you a balanced view of eye surgery. Thank you.